Hi, before we start, we have a trigger warning Klaxx-ON. James is in a bipolar low at the moment, so although James is here with us, he's not able to participate as he usually would, which means you'll be hearing more from me and less from him. We thought it was important to still go ahead with this, though, because it's not all sunshine and rainbows all the time for any of us. And we really think that it's important to show this, because just as all of you go through really rough times, so do we. You're not alone in that. We're not delivering this podcast as fixed human beings and telling you how you can be fixed just like us. We're broken just like you, and we're going through all of this together with you. Also, we know that bipolar and ADHD are common comorbidities. So for those of you that also struggle with bipolar, you're not alone either. Welcome to episode 92. 92, bloody hell. We're getting close to 100 now, of the ADHD Adults podcast. I am Sam Brown, the person who, despite taking medication, is still like this. And as usual, I'm joined by the man who puts the tit in titration, that doesn't really work, Dr. Alex Connor, and the man who takes all the medication and is still broken, Professor James Brown. Hi, Alex. Should we have James in for this? Should I have let him know?
Nah, fuck it. Let's do it on our own.
Okay.
We're after 15 seconds, second square. So, salutations for the medication titration. I don't know. I can't even do it. Hello.
Hi. I don't know. I think I need to check whether James should be here with us. Should I?
Nah, screw it. Let's leave him out there. We'll call him in when he's ready. You know what he's like. How are you?
Okay.
I have to ask.
Oh God. Not great. Yeah, James is obviously in a low. I think it's been caused by me. He says it's not, because it's just bipolar. So then obviously that has a knock-on effect, and I'm feeling low too. And yeah, and we should be feeling really good, because obviously we did the live podcast, which mostly went really well. But we're not, and that's just how it works, isn't it? That things just don't happen as expected.
Most people just say they're fine.
How are you, Alex?
I am excellent, thank you. Yeah, really still processing the bonkers meeting of 400 like-minded, and that is not a normal like-minded people in London. Still digesting it all and thinking about it all, and at the same time, the number of listeners is increasing. One of them sent us a letter, but it's mainly about James.
Well, go on anyway.
I will. Well, the letter comes from a Robert from Kidderminster.
Oh, hi, Robert.
I know. Hi. It says, I listened to your episode of Diagnosis with Dr. Nick. Why aren't you a proper doctor? I guess it even took you 600 years to become a professor. And that's an honorary professor at that. Thanks,
How
Robert.
lovely.
This feels like really kicking someone while he's down, which I like. I like it. We've had a real letter.
Okay, we've got a real letter. Okay,
yeah.
go on.
I don't know if we've checked if we're allowed to read it out, but I'm just going to, and I don't know how to pronounce it anyway, but this is from James. Does that sound like a name? I don't know. Anywho, it says, hi, wavy hand. Just wanted to send a note to say a massive thank you for all taking the time to record the podcast. It's so bloody obvious how much you all care about ADHD awareness and education. And you are also unapologetically yourselves, which is awesome. Timely letter. Thank you, Jane. As someone who's recently been diagnosed, listening to the podcast makes me feel like significantly less of a freak, which is comforting. Your podcast has also empowered me to stop trying to repeatedly force my very square peg into the usual neurotypical holes. Ding! And accept myself for who I am. You are all wonderful and inspirational.
Oh, that's so lovely. Thank you for that, Jamie. And our ludicrous international number, is it up by 1 now?
No, Sam, it's not. It's increased. It's increased by 1. You're right. Yeah, it's up to 150 countries, and the latest country almost probably certainly isn't Barbados, but we'll pretend it is. So huge and
like
hearty.
Barbados.
I fancy knowing that. I've just remembered what I used to do for a living. Howdy, Suppen. Sounded rude, didn't it? Air steward, right? Howdy, Suppen.
Cabin crew, yeah.
Right. James is making me say offensive things. That doesn't feel right. Anywho, hello, howdy, suppen to whoever accidentally asked their Alexa to play a good podcast and then stop listening after 37 seconds.
Hi, everyone from Barbados. As usual, this shell of a broken woman who's pretending she's fine to record a podcast when her husband's in a mental health crisis and she's on the edge of one herself of a podcast is a tragedy in 3 parts. We choose a theme. Last week was about routes to diagnosis in the UK with the brilliant Dr. Nick, and this week to follow up with what is usually the next step for us, titration. The 3 parts, as usual, include a dull start with Alex, the psycho, talking about what titration is, our personal reflections, and our titration process. And then, I don't know, I think I called it wanking last week, so we'll stick with that. Anyway, Alex, tell us, without referring to birds or castles, if you possibly can, what is medication titration?
Yeah, you see, you don't have to be mean just because James is. I was expecting this would be one of those things where we,
That
you
wasn't
know,
mean.
but not that sounded more like a threat though than anything else. So back when James and I used to be relatively polite to each other on this podcast, which is episode 2, that's when we first talked about ADHD medication. And for a quick recap, there are currently 4 medications available in the UK. 3 what they call stimulants: methylphenidate, dexamphetamine, and lisdexamphetamine, and 1 non-stimulant medication, atomoxetine. Medication does not work for everyone with ADHD, but it's pretty good. About 4/5 of us can be successful when we get the right med. The drugs are one of, if not the most successful medication used in psychiatry in general. But you can't just start taking them at a set dose like antibiotics where they flush your system. There is a process by which they've got to get the right dose for the right person and settle down with that. That's called titration.
Okay. And how does it work? Do they start everybody on the same medication and then try them in the same order? How do they, decide what to do?
It's genuinely a good question. Sam, you're just better at this than James. Let's get rid. When he's struggling, let's get rid.
Yep.
Final nail in his coffin, which he actually has. The people who prescribe ADHD meds, who can be usually psychiatrists, but can be non-clinical or rather non-psychiatric prescribers, such as prescribing nurses or pharmacists. Generally, they all have an individualized approach. One psychiatrist I spoke to the other day said that they always start on methylphenidate, largely due to the cost of the NHS, because it was in the UK. But that's just them. Stepping back a little bit, the stimulant medications are the first line drug that any doctor will choose unless they are not suitable for health reasons, like a previous heart condition. Before starting medication for ADHD, people with ADHD should have, and almost certainly will have, a full assessment, which should include, are you ready for a boring list? Of course you are.
Always.
A review of their mental health and social circumstances. B, current education or employment circumstances. 3, risk assessment for substance misuse and drug diversion. And fear, a review of physical health, including medical history, taking into account conditions or meds that might be contraindications for specific treatments. Also baseline height, weight, blood pressure, blah, blah. You may be required to have an ECG or heart trace done first. Most people, in fact, do have that.
So what if, like James, you've got a history of heart disease in the family and you haven't made any attempt whatsoever to look after your heart? What happens then?
Also like James. Well, James's heart is 350 years old, so needs a bit of help. Anywho, needs just a touch of paint. I say paint, I mean blood. He needs blood. What was the question? I got distracted making vampire jokes.
What if you've got a heart condition and you haven't made any attempt to look after your heart?
Yeah. No, it's another good question. Some circumstances, they'll refer you to cardiologists and they'll give you the once over if needed.
I'm supposed to say something else now, but something occurred to me when you were saying the first thing, and I don't know if I should say it or not. So, we can cut it out if you can't answer. You mentioned about people with substance misuse.
Yeah.
So, will they not let people take medication if they've got a history of substance abuse, and why?
It's not a history of it. It's currently using a lot. Well, currently using.
Right.
So yeah,
Okay.
when I remember I originally went for alcohol problems, they insisted that I don't take alcohol while I do it. I mean, it turns out they didn't check, which was
Right.
foolish with me, because I lasted about a day and a half. But yeah, so the meds block cocaine and other drugs and alcohol. They block the medications for ADHD from working properly.
Right.
And they also exacerbate your symptoms. We all know they're not good. We don't judge it, though, do we? Because we all need things sometimes, and that's just
Yeah.
my word. But yeah, they do stop it working. So and we know, and it's difficult. So they're not supposed to combine the two essentially, and normally.
Okay. Thank you for that. You can carry on now.
Okay, so once you've had all the pre-checks, the official guidance from NICE, which is in the UK, it's the NHS's route for clinical excellence, the guidelines for everything. They say offer lisdexamfetamine or methylphenidate as the first pharmacological treatment for adults with ADHD. So that's where most of us start, either on methylphenidate or lisdex. So titration is the process by which how much of that and whether they're effective, and they measure your symptom scores for that, and they look at your side effects. All that's recorded with you and them, and they work out, A, are the meds working, and 2, are the side effects tolerable to you? Titration generally works in 12-week chunks. So after 6 weeks, if your meds aren't working at all, according to the NICE guidelines, you consider switching to the other one. Let's say Lisdex for adults who've had a 6-week trial of methylphenidate at an adequate dose, but have not derived enough benefit in terms of reduced ADHD symptoms, associated impairment, and so on. And that works in vice versa for Lisdex and methylphenidate as well. Also, Lisdex is prolonged release, or being released throughout the day in your body, so that can cause too many side effects. A shorter acting version of that, called dexamphetamine, can be offered.
Okay, so those are the rules. I've been in titration much longer than 6 weeks, and they haven't changed my medication. So if those are the rules, why haven't they changed them?
In this case, it's because they don't want you anywhere near their clinic. That's
That's fair enough.
that's not true. This it's a good point. This is where it's a grey area. So NICE guidelines are just that. They're guidelines. And some people who do titrators, titrators, will have their own approach. And that will be more
Prescribers.
personalized. Prescribers, yeah.
So what about people that can't take stimulants?
Absolutely, Sam. There is another option. Oh, what about ADHD? Bloody ADHD. 70% of people with ADHD do respond to the stimulants. But that still leaves plenty of people. For another 10%, the non-stimulant route may work to a certain extent. Back to the NICE guidelines, they say offer the non-stimulant atomoxetine to adults if they can't tolerate Lisdex or methylphenidate, or the symptoms have not responded to separate 6-week trials, I'm by myself, of lisdexamfetamine and methylphenidate. Having considered alternative preparations, adequate doses, yada, 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 it's also important to say that for some, medication seems like a golden bullet instantly. And for many, many others, it doesn't. It takes time. And even then, remember our old friend shitty metacognition. We're not very good at paying attention. We often, and I'm well guilty of this myself, I think we all are in this room, we often don't think it works when it objectively does. So, like, ask your partner, ask people around you, have your symptoms changed, maybe productivity, etc.
Yeah.
So, yeah, it's a tricky one.
Brilliant. Thank you so much for that, Alex. We're going to take a
What's this
break
have?
now. And we'll come
Oh,
back in part 2 with personal
easy for you
reflections
to say.
on
This,
medication titration.
can we introduce this every podcast, that when I do the boring psychoeducation a bit, James has to say, that was brilliant, well done? Because I think that we should
I don't think
imagine.
that's going to work for him.
Nor do I.
Okay, we'll see you in a bit.
Alex, hi. Aight. What's up? Hello, Governor.
Hiya. Apparently I'm able to do this bit, or so I've declared. So this is part 2 of episode 92 of the ADHD Adults podcast, where we're talking about medication titration. And we'll go into personal reflections. Let's start with Sam. What about yours?
Oh,
as you're being titrated at the minute.
Yeah, I am. So I'm still in titration. I'm currently up to 70 milligrams of Elvance, which is lisdexamfetamine. And I'm really lucky. I've got a really good prescribing nurse that monitors everything for me really closely. She thinks that I haven't seen the optimum benefits yet, which makes me think that I'm not reporting correctly because I keep telling everyone else that things have improved so much for me. So I think I might need to go back and speak to her a bit for that. I should say that I have tics and I'm on a stimulant medication, which did make me tick a little bit more with each increase of my dose. And when I'm really stressed, I still tick a lot more, but then I did before anyway. But I think I'm hyper aware of every little change. And I think lots of people probably are this way during titration because we think that everything's down to the medication. So any little bit, if our mood is low or ticking more or whatever it is, we think, my God, it must be the medication. Whereas there's lots of other things that it could be. So for me, I've realized, as I've spoke to you before, that lots of it is down to hormonal changes for me or external changes like being stressed. But I monitor it all the time and feedback. And so I think I'm probably on the right drug for me at the right amount, but it's been a long time actually. I think I started titration in October and it's now March. So my I was going to say titration officer, my prescribing nurse is really good and is and is taking things really slowly for me because I'm not really sure, and I'm really honest about that, and will say, oh, I don't know if I'm having these side effects because of the, so then she'll, you know, will take it back or be longer on that dose before we go up to the next dose. And I've been on 70 milligrams for quite a while now. Oh, and I should say that I split my dose to help with the ticking because we thought that that might help. But also I think it probably helps it last a bit longer. I don't know. But I don't notice my drugs kicking in or wearing off either, which I think might be unusual. I don't know. I think you're raising your hand, Alex, but it's hard to tell because you're in background shit.
Again, we're not really supposed to bring attention to that. It's part of the audio medium mystique with the Bob Band Flex. I was going to come in with a question, which I've always been interested in the ticking thing, because you said ages ago, I think, might have just forgotten, that you're less likely to mask in front of people you trust, because I noticed you ticking more, but I don't think you used to do it in front of me. Is that true? And is it physically painful to not do it, to mask it?
I can't really mask my tics. Right, there's something I can't control at all. So my stims I can definitely mask because, you know, I'm aware that I'm doing them because it's kind of a comfort thing or a stimulation thing. I'm aware that I'm doing them. My tics, I'm not aware that I'm doing them at all a lot of the time until they're pointing out to me, and I can't mask them. So and sometimes it can cause me a lot of shame if people that don't know that I tic will say, why are you doing that? And I'm like, I'm so sorry, I can't help it. I tick. So no, I can't control my tics at all. I can't stop them. I try and suppress them sometimes, but it just feels like this build up and then they kind of come back more severe and more often. So no, I can't hide my tics, but I can hide my stims.
I really want to not ask James because it'd be funny because he's really struggling, but only
that'd be
funny
hilarious,
for me.
Yeah.
It would. But I feel we have to, James, when you met your titration officer for the first time, what was that like?
I'd just like to start by saying sometimes being in a low place is beneficial because neither of you have mentioned my hair, have you? And I'm pretty sure that both of you are thinking exactly. Yeah. But you didn't, and kudos to you both. So what I say, the first thing is what Sam said about titration. So the 12-week thing.
Although I have to say, it does look like someone's found the negative photographs of a Superman comic.
I don't take that as a I'll take that as a compliment. Actually.
Oh crap! Yeah, I didn't think that through.
Exactly. Thank you. The 12-week thing is it's largely down to funding from commissioners, so they'll fund blocks of 12 weeks normally. But I have heard anecdotally people who've been in titration for up to 2 years, which sounds ridiculous, but they'll often cycle through every different drug and then combinations of drugs. But normally it's over in between 12 and 24 weeks. Remember, I went private when that was a simpler thing to do. and I went straight on to Lisdex, but that's because I have binge eating disorder. And because lisdexamfetamine, again, any child of the 90s will know that speed doesn't make you eat normally. Having my Lisdex, and also, well, yes, but you're, as we all know, very unique, Mrs ADHD. I also split my dose. I'm not going to say the name of the person, but an incredibly well-known comic actor I was chatting to through the charity account said that they split theirs for the same reason. So I asked my psychiatrist, and they said, yeah, absolutely, that's fine. So I'm on 70 milligrams of Lisdex, and I split it 50 straight away and then 20. And with my process, I started off, this is the interesting thing about that individualized approach. You'll hear people start at different doses, go up by different amounts. I started on 20 milligrams of Lisdex, and it did fuck all. And then I moved on to 30 after a week, and that really, again, I didn't feel anything. Then I got to 40, and what I noticed was that my mood increased. Now, Lisdex increases serotonin as well as dopamine and noradrenaline, so it's possible that that was a mood thing because of that. But I was also more motivated. And that didn't necessarily mean I could engage with tasks more, but I wanted to engage with tasks more. So at 40, I started to notice things happening. Went up to 50 and then 60, and around those doses I started being able to do more work, being able to do more around the house a bit, and then I ended up on 70. And to be honest, there wasn't really a difference between 60 and 70, but I didn't have any side effects. So I thought, you know, I'll go on 70 because I don't brag to Alex that you're on a toddler's dose and I'm on top dose. That was literally the main reason I agreed to go on 70. I do. Now, here's the interesting thing, and this is something lots of people will report. Even on 70, and I said this to my psychiatrist using these exact phrases, it's done fuck all for me. And my psychiatrist said, well, you've just sent in your latest. This is after I'd gone through titration and was passed back to the psychiatrist for my discharge appointment. And they said, but I've looked at your ASRS, your symptoms at the start, and now, and every single symptom has moved to the left. Every single one of those 18 symptoms has got better. And, you know, metacognition's a bitch. I genuinely thought, well, these aren't going to work for me then. Even though I knew I was doing more stuff, but those individual symptoms, losing things, you know, struggling to stay seated when staying seated is expected, being driven by a motor, they all felt like they were still very present and hadn't changed. But I had written them down as being, instead of very often, instead of often, sometimes, etc. So it is, for me, it wasn't a magic bullet. I didn't expect it to be, but it did help me start to, I suppose, do stuff and have ridiculous hair. Jesus, look at it. What about you,
That's
Alex?
Actually...
Oh, no, go on.
No, I was just going to say that there's loads of things there that you said that made me realise that I hadn't said them and hadn't covered it all at all. It was the same with me. I didn't notice any effect with my medications at all until I got to about 50 milligrams. And the same with me with 60 and 70. There isn't a lot of difference, but again, thought might as well carry on. And the main difference for me has been my mood and my anxiety. That's what it's improved. But also I get reward from work. And I kept saying to James, and this is really bad because obviously lisdexamfetamine and stimulants that we take as medication are completely different from speed, and it is something that we need to put across, that, you know, there are loads of people all the time on social media that equate medications that are amphetamines as the same as street speed, and it's not at all. But I think in my mind I had got that, and I kept saying to James, I can't feel anything yet, because I thought it was going to be like when I was raving in the 90s and I would feel something, and it's not. It's completely different. This is a pharmaceutical drug that has been developed for this. This is not a drug that's been made in somebody's bathroom that's amphetamine sulfite or whatever. It's completely different, and I think we need to put that across, because we need to kind of quash those negative things that people say about the equivalence between speed and speed. Sorry, Al, you go on.
What if I said that your hair looks like, if there was a key change, you'd have to stand up off a stool with the rest of NSYNC and start singing?
Actually, no one said NSYNC before. I've had a bit of Westlife thrown at me, but yeah.
I don't know who they are. It was just something in my head of probably a boy band. Is that one? Is that one? Have I done one?
Yeah, it's close enough.
Anyway,
so my titration stories are a bit embarrassing because both times no one's ever asked me. Like,
what?
ever. I haven't filled in anything. I've never filled in a form, never had a conversation. Yeah, ever. So both times, well, actually 3 times. The first time methylphenidate, I had a conversation, but it was back in the day. And I just said that'll do at one point because I was afraid. I'm afraid of drugs. I'm medication hesitant, hippie famously.
Yeah.
So just stopped at that level of methylphenidate, and it wasn't good enough for me. It was a bit better. But then I stopped doing them for years. I went back on them, and I realized it wasn't quite right. I knew a lot more by then. Absolutely coincidentally started working with James. He has 0 credit for anything I've done. But no, it was because James talked to me about it. And so when I went titrated on Lisdex, same thing. No one's ever asked me. I just did it myself. And I just kept saying, "Oh, give me more," until I stopped. I was also, I wonder if this is similar to anybody else. I was tempted to go way too far and pretend it was fine just to get loads of high, like, because I thought I like drugs, essentially. But I had to persuade myself not to do that because for the reasons you've given, Sam, it isn't that kind of high, is it at all?
No,
It's just
it's really not. It's completely different.
No, a bit rubbish, to be honest. So yeah, I essentially just figured out what the right dose was. I take 40 mgs of Lisdex and I take it once a day, and then by about, I mean, I'm one of the really unusual ADHDers who doesn't have sleep problems. Like the vast, I think 78% of people with ADHD have sleep disorder. And on average, we're 2 hours delayed in when we naturally go to sleep. And I'm about an hour early compared to the normal population. So I don't have that problem. I know it's a big one for many. What I do notice is some side effects, dry mouth, and when I'm concentrating for too long, I get really stiff shoulders and arms because normally I'd be wiggling about all the time. And it affects my stomach a little bit, and it doesn't affect my appetite, but it does slightly reduce my enjoyment of food. I don't know if anybody's noticed that. No. Yeah, no. And that's it really. No one's ever checked. It's a bit weird, isn't it?
That's really bad.
Yeah, it's good. I never thought about it.
Yeah,
I think what it does highlight is that the disparity between services and titrators. Again, as you said earlier, some of them are psychiatrists, some of them are retrained, if you like, pharmacists, some are nurses that have done qualification to become an advanced nurse practitioner, and some of them may have 10 years of experience of titrating meds for ADHD, and some may have been doing it for 6 months. And therefore, it will vary. I'm not saying any healthcare professional it necessarily isn't amazing, but like any other healthcare professional, they are all slightly different in terms of their experience and knowledge.
I really like that Sam's looking down when it's her bit on the script. I'm intrigued to see where this is going to go.
I was thinking about other things that I hadn't said, but I can save till Thursdays. Now it's time for our weekly game of what has James lost, forgotten, or mislaid this week.
He's far too sad to do this. No, he's too sad. It wouldn't work.
I'm going to do it on something that James did a long time ago.
Is the answer his hairbrush?
I don't think he brushes his hair. Right. So I'm going to give you 3 choices. Okay. So back in the 1400s, when James got his first mobile phone and they were the size of like bricks.
Yeah.
How did he manage to fuck this up? Okay. Did he immediately lose the means to charge his phone and never got round to buying a new charger? So it was basically never used, this phone. Did he immediately lose the phone? Bear in mind that it's the size of a fucking house brick, so that he could never use the phone. Or did he immediately forget his phone number, giving the wrong phone number out to everyone so that nobody ever called him?
That's a good one. That's hard. I don't think it's the wrong phone number. Nobody calls him because nobody'd call him anyway. So it can't be that one. I don't think he immediately lost the phone because they're the size of a house. And so I think he immediately lost the charger. That's what I think.
James?
Oh,
no,
I am delighted.
Yeah, so I didn't understand phones. This was in 1993 when you just had one tiny little digital display and all you could do is type a number in, and nowhere. Before SIM cards as well, there wasn't a SIM card. It was something in the phone, and nowhere did it tell me what my phone number was. But on the back of a battery was a number that looked about the right length, which I assume was my phone number, but it was the battery serial number. So I gave everybody the battery serial number, and then for 12 months, never made nor received a phone call. And the saddest thing is, Al, that clearly nobody tried to call the battery serial number and then somehow else get in touch and say, your phone number's not working, you know?
Oh,
that's because no one else had phones back then.
Yeah, what are they going to phone? The phone, I'm not paying 50p a minute for that.
It was 42 pence a minute.
I can vividly remember phoning my landline phone, my mum and dad's landline phone in the early 90s, and then dialing 1471 to hear what my mobile phone number was because I hadn't got a clue.
Oh, clever. So yes, so James paid for an entire year for a phone that he didn't use.
Back when it was a lot more money for a shit phone. I think that's 7.6. I think you're behind now, Al. 7.6, is that right? For the year?
No,
well,
it's about
obviously not, because I can't remember. Oh, fuck off.
Ultimately level. I don't know.
Anyway, thanks for that, guys. We'll take a break and come back in part 3 with wanking.
Top tippets.
Top tickets. Tippets.
We can't.
Whatever. Bye.
See you in a bit.
Trumpet.
Welcome back to episode 92 of the ADHD Adults podcast, a far superior podcast to normal because it's hosted by Mrs Sam ADHD Brown and with me. And James is here a bit, I guess. He has to be with his hair and his slightly sadness. We're challenging podcast norms today because there is absolutely no way James should be doing this podcast, but he's agreed that he wanted to, and we listened. We are talking about medication titration today, as always, with tip topics, spunk trumpeting or wanking, as Sam started to call it. We're giving our top tips on medication titration. Because I'm being nice today and it doesn't sit well, I'm going to come straight to James. James, have you got a tip from titration?
Yeah, I have. First thing is, if you're medication hesitant, just try them. I know a few people who I talked about this years and years ago, a bit medication hesitant when you first told me that you were ADHD, but when it got round to diagnosis, I would have taken any drug in any dose to not be who I was. So if you are medication hesitant, you can try them. We're talking about medications which have been tried and tested with proven effectiveness and proven side effects. And if you compare that to some of the non-pharmaceutical compounds that people suggest you take, like lion's mane, like omega-3 oil, for which there is no evidence for them being effective in adults at all. They're also chemicals, and if they are effective, they will be doing the same thing as a pharmaceutical chemical. They will be getting into your brain and making things work different. So I don't understand the difference between the two. So maybe be willing to try them. You don't have to obviously carry on, but try them. If you do go into titration, it's really important. We talk about this in coaching. If your aim is to not have ADHD, you are not going to succeed in that aim. So if your aim with medication is to be cured, again, you're not going to succeed in that aim. Everybody's slightly different. I know people who are on 20 milligrams of Lisdex have gone, fuck me, is this what normal people's brains are like? And straight away, they can think, they can focus, they can do stuff. And I know people that go to the higher ends of methylphenidate, where they're having slow release and fast release, and it's percentages. And going back to when we had Dr. Nick on, he, I think, quite eloquently said that it just makes you more functional. The medication allows you to do stuff. Look at Sam with a pencil and a pen on her lip. The medication allows you to fully medicated. The medication just allows you to do more stuff. It's I don't want to make a really awful analogy for other disabilities, but it's like the types of things that people with other disabilities would use to help them to get around or help them to hear something or see something. It just helps. And the last thing I'll say, and this is really important because this is for me and Mrs ADHD, when I think Sam was probably on about 50 milligrams or something, and she just said to me, it's not doing anything, it's not had any effect. And I said, you've gone from within the space of about 8 weeks, lying on your bed for 8 hours a day, playing on your phone, hating yourself because you can't do anything, to doing 8 to 10 hour days of work, to the point where I felt lonely, sat downstairs because she was working till 7 o'clock at night, and you don't think it's done anything. And in my case as well, I said to the psychiatrist, it's done fuck all, it's pointless. And they said, all your symptoms have changed. So when you fill in, if you're asked to, unless like Alex, no one cares and they just let you take the drugs. If they ask you to fill in an ASRS, don't just fill it in yourself. Ask your partner or your housemate or somebody that knows you about these symptoms. Because as we've said, with metacognition, the answers you put on a Monday can be different to the answers you put on a Wednesday, because we are shit at thinking about how we think. Those are my tips. What about you, Mrs ADHD?
Yeah, all of that's true. We're not very good at knowing knowing what, I can't even speak. Monitor all your side effects and your symptoms. Not what? As much as you can. I've forgotten what I'm saying. All your side effects and the benefits as much as you can, and be aware that you're going to analyze every little change and put it down to medication constantly. So I know it's hard, but go slowly, Ding, to monitor your symptoms over a longer period. Oh, fuck, sorry, I had cramp. Over a longer period. Work closely with your prescriber if you've got one that you can speak to, unlike Alex. Titration officer, to tell them how you're doing and whether it's worth persevering with your medication you're on or trying another. If the side effects are manageable and you're getting some benefits, carry on. But if you can't cope with the side effects or they haven't settled down, it's probably worth changing, and give it time, because with a lot of people, when you have a dose change or you first start, you do get some side effects. But with me, they did settle down. And so it was kind of worth. So when I first started medication, I wanted to just skip through it and get to the higher dose. But actually going slowly at each stage and letting the side effects calm down before I then moved on was really beneficial for me. And it didn't have any, I haven't had that many side effects apart from, sorry, I don't know why I'm clicking, apart from increased, increased tics. Like, it hasn't affected my sleep. I've always been shit at sleeping. My appetite is as good as ever, if not better. I do go into hyperfocus a bit more. That's the only thing, but I don't mind that. That's fine for me. I can definitely focus a lot more. I've gone off topic. Alex, what about you?
Sorry, amused me. Yeah, I agree with all of everything you've said, actually.
Okay, great. This was
no, don't expect too much would be the watchword of what you've both just said, really. The meds don't help with everything ADHD. They don't help with a lot of the things people report struggles and problems with ADHD in the emotional side of things. What they do is help with some of the real core things, such as being able to maintain attention. And that's important as well, because if you choose to do something like a hyperfocus, they don't stop you, they'll enable that. And people often say to me, oh, I hated those drugs, I took them, and then I'm spending 3 hours on Wikipedia researching woodpeckers or similar. Well, yeah, that's because you're still you as a human. You're not a robot. You've got to still make choices and decide and learn things, which is my next top tip, really, which is once you're on a stable dose for you of the meds, if you are on the meds and stay on them, ask yourself, okay, shit, what next? Because ADHD doesn't stop there and shouldn't stop there. The psychoeducation we do and the self-education we know most of you do is a fundamental adjunct therapy, quite frankly. And it's that with the meds, if you take them, and anything else you can do to develop that will lead you to that peaceful wildness, James, and help you on your journey towards living healthily. I like it that he's not in the mood to destroy me for these. with ADHD. But that's it really, is to have it, reduce your expectations that they're anything other than an adjunct and a way to just focus a bit more on the things you choose to a bit. I guess that's
Lovely.
it.
Thank you, Alex. Product recommendation of the week. It says drugs here, but I'm going to say some sort of tracker. And you could just do this yourself, actually. All I do as my tracker is I've just got a spreadsheet. And I've just got the numbers from 1 to like 31 and then above it each month. And I write down everything each day when I remember. I haven't done it for weeks. But when I do remember, I put it in. My cycle, everything that could be affecting my mind and everything else, I write down in there so that I can track it and make sure that, you know, obviously I've been taking the medication all month. So if I've got these fluctuations, maybe it's down to something else. So tracker. That was episode.
Wait, I've got a question. Did you spot any times where it was due to something else?
Yeah, hormones, massively. Hormones are the main things that affect me. And every month I forget and have to have it pointed out to me, even though I'm writing it in the tracker. I don't bother looking at it to see if there's any sort of trend.
Amazing.
Yeah, I know. It doesn't work well, but it might work well for others. Anyway, that was episode 92 of the ADHD Adults podcast, and it was on medication titration. If by a miracle you enjoyed this podcast, why not support the charity on the link provided? And because I'm at the helm this week, I want to make it clear that all the money raised goes directly to the charity. We do not receive a penny for this amazing work that we do. Terrible work that we do. We've got big plans in the future to help as many people as we possibly can, and all the money raised for the charity goes directly towards those plans. If you like us, contact us on Discord, the socials. Goodbye.
Bye all.
Trigger warning, Klaxx-ON. Klaxx-ON, 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 big Klaxx-ON. Trigger warning, Klaxx-ON. Klaxx-ON, 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 Klaxx-ON. Trigger warning, Klaxx-ON. Klaxx-ON, Klaxx-ON.